Lack of sleep may do more than leave us cranky the next day. A new study suggests it may have damaging effects on our genes. Dr. Carol Ash is director of sleep medicine at Meridian Health and joins us now. Good morning.
Good morning.
Okay, so what does this study show?
Well, this is an amazing study. I mean, we've long known at Meridian Health that lack of sleep has an impact on your health. But what this study is showing is after 1 week of less than 6 hours a night, it will actually affect the activity of your genes, and up to 700 of them. And genes that control for metabolism, immunity, inflammation, and stress. So this is really a dramatic study.
When you say affect your genes, how does that work and how does it manifest itself in terms of your health?
Well, Charlie, think of the genes as the instruction manual for the production of proteins. Right. And proteins are very important. They're the building blocks for everything in our body. So if you're changing these genes, they're actually turning some on and off and changing the way they wax and wane in their activity throughout the day. And so it literally will affect your health. Heart attacks, stroke, diabetes, obesity, all these things have been linked to sleep. And this is suggesting a mechanism at the molecular level how that may be happening.
Mm-hmm. We hear lots of studies about how the lack of sleep is bad for our health. Why do you think this study is different?
Well, you know, again, the other studies that we've seen have all looked at the endpoint. You know, this is what we can see: heart disease, stress, inflammation. We know when you're not sleeping well at night, you see a lot of inflammatory substances in the bloodstream. So finding the actual mechanism gives us an opportunity to look at future interventions. You know, unfortunately, 24 hours a day, 7 days a week, we're all living in a society that really asks us to push past barriers. Mm-hmm. So having interventions and future treatments is good.
So what are your tips for sleeping better or getting some sleep?
Well, for most of us, I mean, there's 70 million Americans that have sleep disorders. So those individuals, it's a problem. They really need to reach out to a sleep specialist. But for the rest of us, you want to pick the same time to bed and wake up time. So a regular and consistent schedule. Get the right amount. Most of us need 8 hours, and create a relaxing bedtime routine about an hour before bed. And if you do that, Nora, for a week, you should be jumping out of bed in the morning and feel very refreshed.
She already jumps out of bed in the morning.
Dr. Carol Ash, thank you.